Hello, my name is Cynthia Hyman. I'm going to be doing task number 10, which is applying topical disinfectant to a decedent.
And my name is Amanda Yeckel. I will be doing task number 20, which is perform proper treatment for special cases. I'll be going over anatomical embalming, infants, autopsy cases, and donation.
So prior to any of those services that we do often use in the funeral service, we always like to start off with a good primary disinfection, which normally and typically we usually use dish spray. That's the most common chemical found in funeral homes. We usually prefer a droplet type spray as over a pressurized spray, just because much of the disinfectant can be lost to the surrounding area, and we can be inhaling it as the embalmers, which is not preferred. Disinfection also includes making sure there's no body lice, making sure there's no larvae of maggots or maggots themselves. Scabies can also be one of them. If we do find things such as scabies, we do prefer using commercial pediculicides that would be able to be applied to the skin and the hair of the deceased. We just want to make sure that we handle these decedents very carefully, because these conditions can be transferred to the embalmer. Usually you want to check the nose or the eyes or any open orifices for maggot eggs or larvae, especially during the summer and warm climates, because these little larvae can become maggots in 24 hours, and once they become maggots, they are very difficult, if not almost impossible, to get rid of. If you do see that there are these little baby maggots, which usually arise like in the nose or the eyes, you can use a mortuary larvicide to treat them. Another good suggestion would be to pack the nostrils with small pieces of cotton during the summer. And they can be left in the body if they're left in the prep room or if they're being shipped. It is also a good practice that during the summer months to cover the decedent's face and body at night, just to make sure that no flies get on them and lay these eggs, as well as making sure that outside windows and doors of preparation rooms are all screened. If you do notice that there are flies in your prep room, make sure to use an insecticide to treat them.
Okay, so again, my task is to perform proper treatment for special cases. The first one I'll be going over is anatomical embalming. As we know, anatomical embalming is of cadavers that are at medical schools. Medical remains are kept for weeks and sometimes months. For these cases, preservation and sanitation are primary concerns over presentation, since the bodies are not going to be viewed by families. In these embalmings, one artery is used for injection, and cavity embalming is not performed. The body may or may not be drained of blood, and for injection, 4 to 9 gallons are typically injected. The mixture typically contains alcohol, formalin, phenol, a wetting agent, and water. Drainage is typically restricted, which allows for swelling, and that swelling will decrease over time. During dissection, additional chemicals may be applied to enhance the preservation of individual pieces of the body. Okay, so next we'll be going over infants and children. For infants and children, they require definitive techniques that vary from those of an adult or elderly person. As we know, children have a higher body percentage of water and fat, so we wouldn't need to use as many surfactants or humectants in these cases, and probably a little bit of a higher concentration.
For excess moisture.
Yeah, for the excess moisture. The vessels are typically extremely small, but they're not going to be sclerotic because they're young, so this will allow for much better distribution. You obviously want to do a topical disinfectant for every case, including infants. You can place a towel to help position the body. The towel is nice and soft, and the baby is nice and soft, so it's a little bit more gentle than the PVC positioners that we use in the prep room. The eye caps can be cut down to the smaller sizes, and you can use massage cream on top. As far as the mouth closure, you can use the mandibular or the musculature. No needle injector for babies should be used. You can also use rubber or a glue-based adhesive. As far as the positioning of their bodies, you can put their arms on their sides or slightly together as if they're holding a toy. Their head is typically turned to the right and placed laying on the cheek. For the arterial injection, the arteries that are going to be used most common are going to be the common carotid or the femoral, just like in many adult cases. What's unique about the infant cases is you can use the abdominal or the ascending aorta as well.
Especially because their sternum is a little bit more cartilagey, so you can reach it.
Nice and soft and easy to get to. Okay, the next I'm going to go over is your autopsied remains. So you're going to want to unwrap the body and apply a topical droplet spray, not the pressurized spray. Wash the body with germicidal soap and dry it. You want to relieve as much rigor mortis as possible. Shave the body and set the features. And then of course you're going to open up the cavities and remove the viscera from the bag. You're going to treat that viscera with whatever cavity fluid you choose to use, and in whatever way you choose to treat them. Some people decide to pour the chemical right in the bag and place the entire bag back in the cavity. Other people layer it with the powder and then the viscera and the viscerac, and almost like a lasagna. For injection, you're going to inject you're going to do a 6-point injection from both common carotids.
Making sure to clamp all the other open arteries.
I don't know where the other ones went. Oh no, I messed up.
Oh no.
Cut!